Thank you. Minister, I want to congratulate you on the HSE's winter plan. I believe that it is a very ambitious plan and it takes into account the very challenging and potentially competing demands of COVID and non-COVID care, healthcare. I'm very proud that our government has red-circled additional supports for those in the increased risk category, the elderly, homeless and those with chronic illnesses, providing them with home supports. So well done, very, very proud of that. I want to highlight that much was done by government when it came to the support of older adults with intellectual disabilities and mental health challenges in both the public and private long-term residential care facilities from the beginning of the crisis. With the establishment of the area crisis management teams, and they were a vital component in the management of outbreaks within long-term care facilities, upskilling staffs with infection control procedures and implementation, providing PPE provision, public health advice, provision of staff and support on governance. And I note that this provision is being extended within this plan, so again, very, very well done. But Minister, I suppose there always has to be a but, and I have a little but that said, it's a very significant but to those that are affected by this. I want to draw your attention to, and as no doubt has been over the last 24 hours, particularly within both houses here, those of the disability non-residential care sector. I want to advocate for urgent additional supports, ministers, for those organisations, especially in the voluntary and not-for-profit category, who support more than 26,000 people with intellectual disabilities and their families. While daycare services have resumed, but they are on a reduced level still. So we need to urgently address the need for both the clients and their families to receive additional supports, as the current situation erodes the resilience of both the clients and their families. Families have been stoically, intensively supporting their family member in the months while experiencing their own levels of frustration, and some of the reflections that have come to me have been a feeling of being forgotten or left behind when additional supports were announced. In my own home constituency, which is the constituency of Dublin South Central, we have a super organisation called Walk, which is headed up by CEO Catherine Kelly. They believe that people with disabilities have the right to live as contributing members to the everyday life of their community. They support the development and maintenance of relationships which lead to the attainment and sustainability of socially valuable roles and natural support networks, providing employment, training and community living opportunities and supports. But they can't do that work part-time. In response to the lockdown in April, they began to develop online sessions for their day service attenders, and while they have opened back in a limited capacity, observing social distancing and providing services to people with disabilities and their families, those individuals and their families really require this service to run 5 days a week, as that's the most appropriate way of tailoring to their needs. Nadine Vaughan, a mother whose adult son Sam is a service user with Walk, has commented to me that everyone is suffering with the effects of the pandemic and their lives have been curtailed. But for people with special needs and their families, their only outlet is the day services, and their lives haven't just been curtailed, they've been cut off at the waist. So, Mr Minister, I'm asking for your urgent attention on this with regard to the disability day services. Thank you very much.